Hello friends, I'm Dr. Tamim. I'm here with Dr. Sai Dinesh. He's doing his first year residency in NIMHANS Neurosurgery. So there were a lot of questions coming from students about whether they should opt for neurosurgery, how is neurosurgery as a field, what options are there after passing out of neurosurgery, and should people prefer a 5 year or 6 year course post MBBS. So some of these questions to answer them, we are here with Dr. Dinesh. So Dr. Dinesh, please introduce yourself, which college you did your UG from, and
I'm Dr. Sai Dinesh here. I did my MBBS from AIMS Bhubaneswar. I completed it in 2022, last year December. Then I joined NIMHANS in January. So I almost completed my first year by this time.
great. So Dinesh, how was your experience in NIMHANS and how do you find neurosurgery?
Yeah, NIMHANS is one of the best place to do neurosurgery. So by the end of this 1 year, I don't have any regrets taking neurosurgery and doing it from NIMHANS.
Right. So I think NIMHANS is something that everybody dream of, and people try to aspire to get into that. What was your rank at the time when you had gone into NIMHANS?
My rank was Air 99. So
It was 99,
99.
right? Uh-huh. So I think you were lucky, I think, no, to
Yeah,
get 99.
I was like, I was talking with you regarding whether
Yes,
to give
yes.
one more attempt,
Yes, I
whether to
remember.
take general surgery and then go for neurosurgery after 3 months.
True. When you told me that you got, I thought 99 you may not get, but when you told you got, I was also very pleasantly surprised.
Mm.
So anyway, very happy for you. So the question, Dinesh, is what is your message to students who are having dilemma about taking neurosurgery?
So first thing I want to tell is neurosurgery is not a branch which you can choose after getting a rank. So before getting a rank itself, you should have it in your mind that I should take neurosurgery. Then you start preparing for it. Then once you get a rank, you talk with the seniors, talk with whoever are there in that campus. Then you can choose that.
Right. So what problems do you think people will face during the residency and post residency?
So the residency will be hectic. Any surgical residency will be hectic, but neurosurgery it will be a bit more hectic. So our working hours are like from 6 o'clock it will be starting. So by around 9:30 we'll be going to hostel. This is like on paper. That night time it may go till 10:30 11 o'clock. This is the normal elective side. And when you're posted in casualty, it will start at 6 o'clock in the morning, and by 8:30 it will be done. And if you are in night shift, it will start by 6 o'clock in the evening, and by 10 o'clock in the morning it will be completed.
But post duty, are they giving you off to go and sleep?
Post duty off we won't be getting. Like you, we'll be completing our duty by 10:30 in the morning, and evening 6 o'clock you will be going.
Again, you'll be starting next day
Yes.
6 o'clock. Right. I think so. In people who are preparing for, I mean, who are having the dilemma, should we take a 6 year course? See, NIMHANS is aside. That's a separate thing by itself. There are a lot of people asking me, ki, sir, DNB neurosurgery options are available, 5 year courses, 6 year courses. What is your input about those? Should people consider doing them?
Actually, DNB is a bit less sorted compared to this normal MCH course. So that to 5 years is very less sorted. So people usually they won't choose a DNB course because of various reasons. Less
Pass
exposure,
percentages less.
pass percentage, hands-on, all these things will be varied compared to MCH.
So in NIMHANS, how is the thing? They are giving you cutting chances?
First year we'll be doing most of the groundwork. We'll be doing bedside procedures. So whatever bedside procedures, by the end of first year we will be almost perfect with them. So
Right. So bedside
it's
procedures
a
means what exactly?
EVD, lumbar drains,
Uh-huh.
like external ventricular drain, lumbar drains, all these lumbar punctures.
Okay.
By the end of first year, tracheostomy, surgical tracheostomy, all these things will be perfect.
Okay. And I think you'll get posted in BMC also, no, for some time?
From second year, like
Second year.
whole entire second year will be posted in BMC, sir.
Okay. And then again you come back to your
Again
parent
we
unit.
come back to.
So do you have rotation in NIMHANS or is it a fixed one unit?
No, NIMHANS has 6 units in neurosurgery, 6 units in neurology, and 6 units in psychiatry. So the usual roster will be like every 1 month there will be change of roster. So due to some circumstances, it may get delayed. 2 monthly will be you can be posted same place. and ideally you will be posted in casualty half of the time and normal elective side half of the time. So 6 months you will be in casualty, 6 months you will be in elective
Okay,
side.
and it can be in any unit in neurosurgery.
It can be in any unit in
Six
neurosurgery.
6 units are there. It can be in any 6
Yes,
units,
sir.
right? So I think that's really good. No, so you'll get to taste of different units
Hmm.
and different expertise of their surgeries. You get
Yes.
to see. So I think anytime rotation is there, always beneficial.
Yes.
Great. So what advice do you have for your juniors?
So my only advice is like a neurosurgery is not a branch which you can think after getting a good rank. Like it's very what to say, like
You should dream for it.
uh, from outside it may look glamorous, like it is one of the uh, best branch to take, especially for post MBBS students like me. We won't be having much idea about the branch, like during our UZ, during our internship, unless we are very interested. We won't be going to the department at least once or twice. So if you are really passionate about neurosurgery, then only you have to take it. Otherwise, after getting a rank, you start thinking about neurosurgery. So it's not good. Like I have seen students leaving the course. Even one of my juniors, he left the course after taking the seat
Because of the work,
because
is
of the
it?
work.
It's hectic.
So the thing is, neurosurgery demands a lot, both physically and mentally. It demands a lot. You'll be bugged by your seniors, consultants daily. And all those are learnings. Means whatever they want to teach you, they'll be teaching in their manner. Some teach with love, some teach with this thing, some teach with scoldings. So whatever is daily, you will be learning the things. So in the process, there will be a lot of mental pressure also. Not only physical, working hours are long, that I agree, but working hours are long in almost any surgical branch. So in NIMHANS, that working hours, it doesn't matter. Every day you will get a sleep time of almost 7.5 hours.
That's very good, no?
Yes.
That's good enough.
This
actually.
you'll be getting all out the 6 years.
Great.
So it's not a problem. Like what I feel is working hours wise, NIMHANS is better compared to any other institute.
Right. I think many people feel that, particularly Delhi, for example, AIMS Delhi, it's more difficult to work. There's more hectic rather.
Yes.
And I think workload-wise, NIMHANS is better, but you get better exposure, I think, in
Yes.
NIMHANS. Variety of cases are more.
Yes.
Right. So, what options are there post neurosurgery? What fellowships are available? What options are there?
Post completing our post MCH course, if you're interested in some specific department like subspecialty, like you want to do endoscopic surgery, you want to do skull based surgery, this depends on like what you want to do specifically.
Like deep brain stimulation, also, I think, one
Yes.
more option. So, all those, does NIMHANS have those kind of departments?
Currently NIMHANS doesn't have that, but people get posted as externals from like other countries.
Right.
They'll get posted here for 2-3 months to get the experience of what is going on. Like special courses were not there, sir.
Okay. No, but do you get a benefit of their getting posted? Those people posted as professors or
No, sir. They'll be posted as residents only.
residents? Right.
But what I feel is, if you do your residence in NIMHANS, well, you don't need to do any other fellowships.
Fellowship, you'll get exposure
You'll get
here
exposure
only.
to all.
So, do you do deep brain stimulation and all that in NIMHANS?
Yes, sir. Our one of our consultants will be doing every weekly 1 or 2 cases. He'll be doing.
Okay. And anyway, you'll get rotated, so you'll get a taste of
We'll
everything.
get a taste of it.
Great. So I think for those people who are out there who are dreaming about joining NIMHANS, I think it's one of the best places to be in, both for DM Neuro, Psychiatry, and Neurosurgery. How are the work options post NIMHANS? What people, do they stay in India? Do they go abroad? What options are there?
So there are multiple options. You can, if you are okay enough, like to set up this thing, you can set up your private practice, or else you can join in any tertiary center as consultant. You can join in NIMHANS itself. So people, some people they go abroad also. They clear USMLE, then they go abroad.
Okay, for that USMLE step 1, 2 both are required, only step
Yes,
1?
both are required.
Both are required. And there they have to do residency once again, or they just get into...
If they want to do neurosurgery practice in states, like they have to do again 7 years course.
7 years. And has anybody done like that?
No, sir, I don't.
But there are people who do fellowship and
They come back like
Yeah.
If they want to do fellowships, this USMLE helps. Like,
True, true. So I think for the question that some students are asking about DNB, see the 5 year, 6 year DNB courses in some places is not good, and we cannot generalize and tell you should take here, you should not. Like in Bangalore, I know for a fact that Satya Sai, Narayana
Narayana,
are
good enough.
are very good. Now there are some others that are not that good, where people feel up by second year that they are not getting any chances. By the end of 6 year, they feel they'll not have any option. I mean, they feel suffocated. They are not getting chance also. They are not learning also. They are just working. That kind of environment we cannot generalize and tell now here. I think individually they have to visit the place and then check it out whether it's good or not. Each city will have centers like how we have here in Bangalore. Like I was telling you, Narayana and Satya Sai. Yes. So like that, there are I think other places also. So I think in general, neurosurgery also is a demanding field where you have to really dedicate. You have to work for long hours. But once you get through, I think then work-wise you don't have any. I think road traffic accidents in India will never stop. So tumors also, I think a lot of work is there.
And neurosurgery is one of the most satisfying branches, sir. Like you will see patient deteriorating in front of you, and you can save him with an EVD. Like that satisfaction when you get when you hit the ventricle and patient improves is immense.
Great.
I think you won't get that satisfaction in any other branch. Like within a span of seconds, you will see that patient improved within. But at the same time, he may deteriorate also.
True, true. So, but then you feel very happy that a person was almost going to die. Your intervention saved him. I think that is a very big reward in itself. So it's been great talking to you, Dinesh. Any final words you want to say before we conclude?
Neurosurgery is a demanding branch, both physically and mentally. So if you are prepared enough, you can be taking. And NIMHANS is one of the best place to do neurosurgery in NIMHANS. I am very lucky that I got a seat with my rank in NIMHANS.
I think you studied with Bhate only, no, at that time?
Yes, sir.
Right. So I think it's been great talking to you, Dinesh. So our best wishes with you, and thank you so much.
Thank you, sir.